Hi, this is Dr. Drew. One discussion that we often have with patients at the time that a tooth is needing to be removed is whether we should do socket preservation or bone graft in that area. And socket preservation is what it sounds like. It's a procedure done to preserve the socket or the site surrounding in the bone surrounding where the tooth originally was. What the goal of socket preservation is to maintain the integrity of the bone in that area, essentially trying to get the area where the root of the tooth was to fill back in with bone instead of filling in with gum tissue or soft tissue. The reason we would want to do something like this would be to keep our doors open or options open essentially for future procedures to replace that tooth, such as an implant or a bridge in that area. So the way socket preservation is commonly done is at the time of the tooth removal, the area where the tooth previously was in the bone is filled in essentially with bone material. There's different types, things that can be used. Some of there's some synthetic materials that are placed at times. Some come from animal grafts or transplants. Some can come from the patient themselves, bone removed from another area. One of the more common ones that's done that we often do here is what's called an allograft. It's a cadaver bone, essentially, and that bone is professionally harvested or removed from a cadaver by a professional bone bank. It's cleansed to protect the patient, and it's essentially the scaffolding for the new bone or the patient's bone to grow into and create strong hard bone in the area. So that's a very favorable situation when placing an implant to have good, hard, strong bone in the area. Otherwise, it can be difficult to get an implant essentially to take in that area. So again, not every place needs socket preservation. That's something that's, we look at on a case-by-case basis when a tooth is being removed. Again, the best thing to do is to discuss that, with your dental provider and determine if that's the best thing to do in your scenario. And I hope that helps.